When you're talking about just stress incontinence, where when you laugh, when you cough, when you sneeze, urine comes out, there's been something about that has brought the bladder down and changed the angle between the bladder and the urethra that comes where the urine comes out. It changes that angle so that when it comes down and you cough, the urine squirts out instead of it going forward and blocking it so it doesn't come out. Women who've had large babies, multiple deliveries and so forth, really do go through a lot of trauma to the pelvis that can also result in the bladder coming down and becoming incontinent. But you also have people who just, it's genetic. If you are very active, like many of our women are today, and really vigorously exercising and so forth, every time you tighten your abdominal muscles, it tends to push down into the pelvis, and you might have more stress incontinence than your sister who doesn't exercise. If a woman says, yeah, when I really laugh hard or if I get a real bad cold, I'll dribble a little bit, it can be evaluated, and there might be some very mild treatment that we might initiate, but it generally doesn't require anything specific. But when you get the lady who says, oh, I don't want to go out of the house anymore, I smell like urine all the time, I wear a pad all the time, this is a point where we can usually do something that isn't real drastic that can solve the problem for her without her having to spend her life savings buying protective gear. Like I have some ladies, they like to trampoline, or they love to go to the gym, and they like to play basketball, or they love to jog or run, and they say, you know, normally it doesn't bother me, but I can't go to the gym because I have to do this. So it really is an individual decision to decide, do I want to go through an operation to take care of this problem? This problem is affecting me to the point that I'm anxious to undergo a surgical procedure that'll stop me and give me relief from my symptoms. There's no medical definition that you say, this is the drawing line, beyond that you need surgery, below that you don't need surgery. The problem with stress incontinence is how much is it affecting my life? Would I rather live with it, or would I rather go through an operation and hopefully fix the problem? Nothing is 100% in this issue. It's not like a faucet. We put things back where we think they should be. We do as good a surgery as we think we possibly can, but things can happen that aren't wrong. And that's why you don't jump into the surgery if you're just leaking a little bit. I try to tell people, don't have surgery if you leak once in a while, because the best surgeon in the world, when he gets all done, you still might leak once in a while. What we're looking for is a lady who's just really having trouble. A woman who's wearing a pad 24/7, I know that she's having a lot more trouble with her incontinence than somebody who never wears a pad. So that if you don't get a 100% result, a 90% result is 90% better than you had before.